Women with uterine fibroids could be at greater risk of heart disease. That's according to a new study published this week in the Journal of American Heart Association. Here to break down that study is our 9 News health expert and resident cardiologist, Dr. Payal Kohli. So let's start with what are fibroids? Because I feel like, 10 years ago, you never heard about them. And now I know so many women who have gone through that very painful process of having them removed and living with them. What are they?
Yeah, so they're benign tumors of our uterus, and they grow in the muscle part of the uterus. And they can be as small as a pea, or they can be as large as a grapefruit. I actually had somebody in medical school who had a basketball-sized fibroid. And you can imagine it can grow into the cavity of the uterus. It can grow externally and compress the organs outside. The good news is they're benign. The bad news is they're very, very common. So up to 70% of women, 70% by the age of 50 will have a fibroid. And the interesting thing is that most women, 50 to 60%, won't even know that they have a fibroid. It'll just get picked up on a pelvic exam. Of course, if you have a very large one and it's pushing on something, your bladder or your back or the uterus, you might have heavy periods, you might have pain during intercourse, you might have, frequent urination, you might have those types of symptoms. But the fact that they are associated with heart disease, to me as a cardiologist, is just fascinating.
And what are the risk factors in developing a fibroid?
So family history is a part of it. Age is probably the biggest risk factor. So after the age of 40, we are a higher risk for fibroids. Being African American confers you a 2 to 3-fold higher risk, not just of having fibroids, but of having more of them and having them earlier in life. Many of the things that cause heart disease also cause fibroids. So consuming alcohol, especially beer, has been linked to fibroids. Red meat, specifically ham, has been linked to fibroids as well. Having high blood pressure can also increase your risk of having fibroids. So it's pretty complicated and complex. We know that these are hormone-sensitive tumors. So never having carried a pregnancy can also increase your risk of having fibroids. And interestingly, birth control pills, especially if you're taking combination, reduce the risk. So even though they're hormone-sensitive, it's mainly the estrogen that tends to drive them more.
It is interesting. So what is the connection between fibroids and heart disease?
Yeah, so we hadn't realized until now, and this study was really quite provocative. It looked at 2.7 million women, and about 500,000 of them had fibroids, and it compared the ones with fibroids to the ones without fibroids. And at every level of risk, for stroke, for heart disease, for cardiovascular death, if you had fibroids, you had a higher risk at 1 year, at 3 years, at 5 years, and at 10 years of having all those bad outcomes happen. So what we don't know is it the chicken or the egg, or is it the same thing causing both of those? We don't know if one is leading to the other, but we do know that, like I mentioned, a lot of the risk factors are shared. So having a bad diet and drinking too much alcohol, having high blood pressure, these are all risk factors for heart disease as well. But it's interesting because it's a muscle tumor, right? And what is the heart? A muscle, right? And what are the blood vessels? A muscle. And so we're wondering if something that's driving the muscle tumor is also driving stiffening or dysfunction of the heart or the blood vessels as well.
Will this change just the way you diagnose heart disease within your office? Are you going to start asking about fibroids?
Completely. In fact, it's funny, during medical school, we used to joke that cardiologists stay above the diaphragm, kind of waist up, and the gynecologists go waist down. But now, and I've been doing this for some time, but a lot of my colleagues haven't, we need to do something called a cardio-ovary history, which means how many pregnancies did you have? What age did you start your periods? How many, complications did you have? Whether you have fibroids. These are all things that could affect your heart disease risk. In fact, having a fibroid now, I'm going to perceive as putting a target sign on my women for having more aggressive and more premature heart disease. And you would think that if the fibroid's causing the problem, if you take it out, it gets better. But actually the opposite. If you have a hysterectomy, that actually accelerates the aging of your cardiovascular system. So something about removal of the uterus and lack of blood flow to the uterus makes other blood vessels age more quickly. So for me, whether you have a fibroid or not, you need to talk to your doctor about seeing a cardiologist and seeing whether or not you might be higher risk, especially if you have any of these potential risk factors.
Yeah, and to see how common and prevalent they are. I went to the OB/GYN this week and, dealing with certain symptoms, are like, let's get you for an ultrasound. We need to see if you have fibroids. Like that literally happened to me 2 days ago.
Yes.
Yeah.
So
if anyone finds a fibroid, even a tiny one, like I said, a pea-sized or a grape-sized or anything like that, it puts a target sign on you for heart disease, and you probably need to be aggressive with risk factors.
How do you treat fibroids before we let you go?
Yeah, so there are many different ways to treat them. Commonly, especially if they're small and not causing too many symptoms, they'll put like an IUD in or give you some hormones to kind of shrink the size of the tumor. Menopause sometimes naturally sort of shrinks your fibroids because the hormones go away. But if they're really large, they can do something called uterine artery embolization, where they actually kill off the artery that's feeding the fibroids, so it just kind of shrivels up. Or in kind of more severe cases, they might do surgical resection or a hysterectomy.
Wow, very interesting. Dr. Kohli, thank you so much.